So you'd put it on the knuckle of the foot? That's what you said.
Mm-hmm.
Yeah.
Okay. Knuckle of the foot.
Check for the redness, dryness, or swelling. Inspect color, temperature, and then cap refill.
Those are the other tests, like you were talking about the tuning fork, and then there's the EMG to see how nerves and muscles work together. Treatment. Okay.
It's basically the same thing.
Did that go back? I think. Just prevention of living with neuropathy. You want to make sure that you protect mostly your feet with protective footwear. That's one of the most important things with the patient because of the decreased sensation. They're not able to tell if they're stepping on something. It's one of the things that people pay probably the least the most attention to is their feet. Be aware of temperature changes. If something's too hot, you're not really going to be able to detect it with your feet. You always want to assess your feet and hands for any cuts, abrasions, burns, and injuries. Drinking alcohol can increase the progression of neuropathy. If a patient has unsteady gait, they want to use assistive devices for themselves when they're walking. I work with podiatrists. Our podiatrists always encourage our patients with neuropathy or diabetes to not cut their own toenails because there's always that chance that they're going to nick and they're going to get an infection that's just going to spread, and it's hard for them to get that under control with neuropathy, and it can lead to amputation.
So what about you? I'm just going to throw this out there because what about you? You're bathing a patient who has who's a diabetic. Let's just say they're diabetic and they've got some awful long toenails. What are you going to do about that?
Call the doctor.
Consult.
What are you going to do? Nothing. That's right. You are not going to cut those toenails. You will get a podiatry consult in the hospital. That's the best approach because it's a delicate. You think what cutting the toenails, that's no big deal. But it's a delicate operation for these kind of patients. So you would get the podiatry consult.
It also helps to eat a well-balanced diet, keep your blood glucose levels under control, taking medications exactly as prescribed. Don't smoke, never walk barefoot, whether you're in the home or outside of the home. And if you don't see a podiatrist and you just go see a regular doctor, you remind your patient to, sometimes you have to remind a primary care doctor to take your shoes off and check your feet. And here we have a YouTube video.
Watch diabetes videos at clearlyhealth.com. As a person with diabetes, it is important for you to
Do you guys hear
care for
it?
your feet properly
How do I turn it up on the phone again?
if you have nerve damage. As neuropathy, you may not feel pain if you injure your feet. Because of this, an infection can develop without warning. Decreased blood circulation slows healing. This can result in foot ulcers, which can eventually lead to amputation of the feet or legs. Prevent foot injuries by wearing shoes that fit well and have good support. Don't walk barefoot. Check your shoes before putting them on for small pebbles, worn areas, or rough spots. Avoid sandals, pointed toes, high heels, and plastic shoes. Always wear socks in your shoes. Socks are better if they do not have seams or mended areas. It is important to check your feet every evening for cuts, sores, red spots, swelling, or infected toenails. If you have any of these problems and they do not heal within 24 hours, it is important to contact your healthcare provider. If you have trouble seeing the bottom of your feet, try using a mirror. Before bathing or showering, test the water to make sure it is not too hot by using a thermometer or your elbow. If you use a thermometer, between 90 and 95 degrees Fahrenheit or between 32 and 35 degrees Celsius is safe. Water that is too hot can damage the skin. Do not soak your feet, as they can become dry and cracked, causing infection. Be sure to dry your feet well, using a patting rather than a rubbing motion. Be careful to dry between your toes and use talcum powder or cornstarch to keep the skin between your toes dry. Apply lotion to the top and bottom of your feet to keep them soft. Do not apply lotion between the toes, as this can cause the area to become too moist. Thick or hardened skin on the toes and bottom of the feet, called corns or calluses, can appear from skin rubbing against bony areas of the foot. If you have corns or calluses, it is important to talk with your doctor about how to remove them. Do not use corn plasters, corn and callus removers, or blades, as these may lead to infections. Trim your toenails straight across once a week. Smooth sharp edges with an emery board or nail file. Contact your doctor if they become thick or yellowed, or begin to curve and grow into the skin. Avoid using heating pads, hot water bottles, or campfires to warm your feet, and carefully check your feet during cold temperatures for frostbite. Keeping your blood glucose levels in your target range through healthy eating and daily exercise can prevent or decrease nerve damage caused by diabetes. Daily foot care, comfortable shoes, and having your healthcare provider examine your feet at least once a year can help minimize serious long-term damage caused by diabetic neuropathy.
For our full library of healthcare videos, go to clearlyhealth.com.
Remind me to tell you something.
Any questions?
That was good.